Hi family and friends in India. I am making this video especially for you. This is not to panic you or to get you all afraid about the coronavirus, but this is to make sure that you have reliable information from me, information that will help you make good healthcare decisions. Unfortunately, in the last couple of days, I've noticed that a lot of my friends and family in India are passing on and forwarding a lot of messages from Facebook, from WhatsApp, and other sources on the internet that are really not true. So I want to make sure that I give you correct information today. As all of you know, I have a Doctor of Medicine degree in internal medicine, but many of you may not know that I also have a master's degree in public health. And what that means is I have additional training with regards to how these diseases spread in populations and how to change that spread by making people change their behavior. I'm going to actually just read this so that I can make sure you have all the important information. This may not be the most entertaining thing or the most professional presentation you've seen, but I want to make sure that you get all the good information that you need. One of the things that I'm hearing from my family is that all the schools are out, but regardless of that, all the people are going out and are gathering in groups. And this is making me think that maybe people don't realize why the schools are out. Or even if they realize it, maybe they don't realize the importance of it. And that is one of the reasons I'm going to start with the basics and then we'll move forward. So what is the coronavirus? The coronavirus is a virus that affects your lungs. And this is just based on what we know. This virus is new, so we're getting information every day from various different countries that are dealing with this problem right now. So what I'm telling you right now may change a little bit in the next few days or weeks, but this is the most up-to-date information that I have. The coronavirus causes cough and difficulty breathing. Mild cases are no more severe than a common cold. Some people may have such mild disease that they may not even know that they have the disease. Other people, however, especially older people, may get severe problems like pneumonia, organ failure, or they may even die. Now, 80% of the people with the coronavirus have very mild disease without requiring hospitalization. Now, that sounds pretty good. But the flip side to that is 20% of the people are requiring hospitalization. So just think about if 20% of those people showed up in the hospital. This is a huge number of people, and hospitals in most countries cannot deal with this. This also means that these 80% of people that are mildly infected are walking around giving it to other people without even realizing that they're giving it to other people. And that one other person that they give it to may be an elderly person or a person with medical problems that is going to get really, really sick and that might die. Now, 2 to 3% of people in China who have got the virus have died. And in South Korea, where they have done a lot more testing, only about 1% have died. The average mortality or death rate from the seasonal flu that comes every year is 0.1%. These numbers may look very small, but 0.1% versus 1% is still a factor of 10 different. So 10 times more people are potentially likely to die from the coronavirus than from the flu. The elderly patients have a much higher rate. This 1% and 2 to 3% that I talked about earlier is for the average population. So it includes everybody from children all the way up to the elderly. But when you look at the elderly, they have a much higher rate of death, which is 15%. And people between the age of 50 to 80 are somewhere in between 3 to 15%. So even if you are young and healthy, you could give it to your parents and your grandparents who will get much sicker than you. So just because you're feeling well doesn't mean that you should go around and gather in groups, talk to your friends, and be around your grandparents and your parents or other people who have medical conditions. Half the people with the virus in France right now who are hospitalized are under the age of 60 years old. So just because you're not 80 doesn't mean that you're not at risk of getting some significant illness that may put you in the hospital. Children don't seem to be affected as much as adults. Normally, in outbreaks like this, we're very worried about our children. But fortunately, unlike the regular flu, the coronavirus doesn't seem to be affecting children very severely. The virus does also appear to be about twice as infectious as the flu, so which means it spreads about twice as fast as the flu in the community. Unlike the flu, there is no vaccine for the coronavirus at this time. A lot of people are working on the vaccine, and in fact, the first testing for the vaccine on humans has started in the United States just recently. But it's going to take anywhere from 12 to 18 months before the vaccine will actually be available to the public for general use. We have very limited tests that are available right now. And even if we have tests, the labs do not have the facility to run all these tests. There are currently rumors of fake testing going on in India. So please be careful about that. The disease spreads by droplets and not through the air from what we know now. So masks are effective only to prevent people who are sick from spreading the virus. It will not help if you are healthy. So save the masks for the sick people and the people such as the doctors and the nurses that are working in the hospitals. There is no drug treatment that is effective to prevent or treat this virus right now. In India, there have been a lot of news about fake Western medicine, fake Ayurveda and Siddha tablets, syrups, oils, and potions that are being promoted for the coronavirus. Do not buy anything that is currently being sold specifically for the coronavirus. 44 people died in Iran after taking fake treatment for coronavirus. I will let you know when something real is available. All the treatment that we have right now is supportive. That means if you have mild symptoms like a cough or a fever, you need to stay home and take some Tylenol. In India, that's called paracetamol. Take some paracetamol, cough drops, drink plenty of water. If you're really sick, then in the hospital, they still don't have specific medications to treat the coronavirus. So if somebody is telling you otherwise at this point, that is not true. So if you go to the hospital with difficulty breathing, they're going to give you oxygen or they're going to put you on a breathing machine. If you are dehydrated, they will give you IV fluids or what you call drips. Now, if you're and the last thing is, if your organs are failing, they're going to give you medicines to keep your blood pressure up. But we do not have any antivirals right now that are going to cure this virus. Now that I've told you these facts about the virus, I want to give you a little bit of information about what you can do to prevent and prepare for this virus. The best thing to do right now is to stay home and minimize contact with other people. This is very difficult to do in India because we're all so used to getting together with our family and friends in large groups. Right now, you all know that the schools have been closed, but this doesn't mean that we should get together in each other's homes. Doesn't mean that we should call our friends and go out and have a good time. You can have a good time, but just don't be near each other. You can call them on the phone, you can do a video chat, or you can meet in small groups of 1 or 2 people where you can make sure you're washing your hands and wiping things down before, when people touch items in your home. So avoid all gatherings and stay at home unless absolutely essential. This includes churches, temples, and other places of worship, birthdays, weddings, and all other functions, even if it is a very small group. Wash your hands with soap and water thoroughly for at least 20 seconds. This is much more thorough than what we Indians normally do, which is just sort of rinse our hands under the water after we eat our food. This is really scrubbing your hands with soap and water for at least 20 to 30 seconds. Make sure you wipe down your door handles, especially if your front door where people are coming in and out, sink taps, and kitchen counters with a household cleaning spray. Make sure and buy enough paracetamol, 500 milligrams, and cough drops to treat your family for 2 weeks. And you need to make sure you can have 1 dose for every 6 hours. Please do not overbuy and empty out the stock in the pharmacy. Only buy what you need and leave the rest for others. Make sure you have food staples like rice, flour, and dal for 2 to 4 weeks. Please do not buy everything in the store with nothing left for other people. If you are on medicines for serious diseases like diabetes, heart disease, or blood pressure, please get enough to last 3 months. Avoid all travel except for absolutely essential reasons. And please, please do not forward messages on social media if you are not certain of its origin and it is not personally from a doctor you know and trust. Now, what do you do if you have a fever or cough? First, just because you have a fever or cough doesn't mean you have the coronavirus. It could be one of many other infections like the common cold or the flu as well. The most important thing is, if you normally would not have gone to the hospital with your symptoms, then don't go to the hospital now wanting to check if it is coronavirus. The hospital is for really sick people. So please save the hospital beds, the doctors, the nurses, and the masks for the really sick people. Stay home if you have mild symptoms of just fever or cough. The hospital cannot do anything more for you that you cannot do for yourself at home. There are no drugs for the virus yet, so they can't give you anything to cure it. We only have paracetamol for fever, cough drops to soothe our throats, and water to keep us hydrated. A lot of mildly sick people in the hospital, for no reason other than to check if they have the coronavirus, will only cause a lot more problems. First, there are not enough tests, and the labs don't have enough machines to run all the tests. So it is most likely you won't get the real coronavirus test. I'm also hearing rumors of being people tested and put in the hospital for 7 days for any fever or cough. Right now, we do not have enough tests to do this type of activity. So next, you're much more likely to pick up something more serious from the really sick people who are in the hospital. So I beg of you to please stay home if you have mild symptoms and not go to the hospital. So when should you go to the hospital? If you have high fevers, 102 degrees Fahrenheit or more, that are not coming down with paracetamol, if you have difficulty breathing, if you have dizziness, or you have confusion, then please go immediately to the emergency department of your local hospital. Make sure you take a list of all the medicines that you take on a daily basis to the hospital. Now let us all stay home, read storybooks, play games, cook something complicated, tell jokes, watch movies, stay hydrated, and wash your hands. Stay healthy, and thank you.